Question 1. A behavior analyst is asked to provide services for a client whose needs are outside the behavior analyst's area of training and expertise. According to the Ethics Code, what should the behavior analyst do? A. Accept the case but consult with a colleague who has experience in that area. B. Accept the case and learn on the job to meet the client's needs. C. Decline the case and provide the client with referrals to qualified professionals, if possible. D. Accept the case but only implement procedures the behavior analyst is already familiar with. Answer: C. Decline the case and provide the client with referrals to qualified professionals, if possible. This question tests your understanding of a behavior analyst's scope of competence. The phrase outside the behavior analyst's area of training and expertise is the key clue, indicating the situation involves a service request that exceeds the behavior analyst's qualifications. Ethical practice requires behavior analysts to only provide services within their area of competence, meaning they should decline cases they are not qualified for and offer referrals when possible to ensure the client receives appropriate care from someone who is competent. Accepting the case without proper training or supervision would violate this principle and potentially harm the client. Remember, your ethical duty is to ensure the client receives competent services, even if it means referring them elsewhere. Question 2. A behavior analyst working in a school setting is asked by a teacher to share confidential client information about a student with the student's other teachers and the principal who are not directly involved in the behavior plan. What should the behavior analyst do? A. Share the information as requested because they are all school staff. B. Share only the information that is directly related to the student's behavior plan. C. Refuse to share the information unless given written consent from the student's parents or legal guardians. D. Share the information but ask the teachers and principal to keep it confidential. Answer: C. Refuse to share the information unless given written consent from the student's parents or legal guardians. This question is about client confidentiality and obtaining proper authorization to release information. The keywords confidential client information and not directly involved in the behavior plan highlight that sharing this information without consent would be a breach of privacy. Behavior analysts must protect the confidentiality of client information and only disclose it with appropriate consent from the client or their authorized representative, or when legally required or permitted, like to protect someone from harm. Sharing information with individuals not directly involved in the service delivery requires explicit permission. Always remember that client privacy is paramount, and you need informed consent before sharing their protected information. Question 3. A behavior analyst is developing a behavior reduction plan that includes a punishment procedure. According to the Ethics Code, what must the behavior analyst do first? A. Implement the punishment procedure immediately if the behavior is dangerous. B. Ensure that reinforcement-based procedures have been considered and attempted first. C. Obtain verbal consent from the client or guardian. D. Conduct a functional analysis after implementing the procedure to see if it works. Answer: B. Ensure that reinforcement-based procedures have been considered and attempted first. This question focuses on the ethical hierarchy of behavior change procedures, specifically concerning punishment. The phrase behavior reduction plan that includes a punishment procedure signals that ethical considerations for restrictive interventions are relevant. Ethical guidelines mandate that behavior analysts recommend and attempt reinforcement-based procedures before considering punishment, as punishment procedures carry more risks and ethical concerns and should be reserved for situations where positive interventions are insufficient. Obtaining informed consent is crucial, but follows the decision to use a procedure based on the assessment and consideration of less restrictive alternatives. Always prioritize positive reinforcement-based strategies first when developing behavior plans. Question 4. A client's parent offers a behavior analyst an expensive gift as a token of appreciation for the progress the child has made. What should the behavior analyst do according to the ethics code regarding gifts? A. Accept the gift gratefully as it shows appreciation. B. Decline the gift and explain the ethical guidelines regarding accepting gifts from clients. C. Accept the gift but disclose it to their supervisor. D. Accept the gift but offer a small gift back to the parent. Answer. B. Decline the gift and explain the ethical guidelines regarding accepting gifts from clients. This question addresses the ethical guidelines around financial and non-financial relationships, specifically regarding gifts. The keyword expensive gift is a strong indicator of a potential conflict of interest or blurring of professional boundaries. Behavior analysts are generally prohibited from accepting gifts from clients or stakeholders because it can create a dual relationship, compromise objectivity, or influence professional judgment, regardless of the giver's intent. Declining the gift while explaining the ethical reasons helps maintain professional boundaries and educates the stakeholder. Avoid accepting anything more than tokens of minimal value to maintain professional distance and objectivity. Question 5. Before beginning services, a behavior analyst provides a potential client with detailed information about the proposed assessment and intervention, risks and benefits, costs, confidentiality, and their right to withdraw at any time. What ethical concept is the behavior analyst demonstrating? A. Assent. B. Confidentiality. C. Informed consent. D. Functional assessment. Answer. C. Informed consent. This question tests your understanding of informed consent, which is a cornerstone of ethical practice. The detailed description of providing information about services, risks, benefits, costs, confidentiality, and the right to withdraw are all key components of the process of obtaining informed consent. Informed consent is not just getting a signature. It's an ongoing process of ensuring the client or their legally authorized representative understands the nature of the services and agrees to receive them voluntarily. Assent is agreement from someone unable to give legal consent, like a child, but doesn't replace informed consent from the legal guardian. Always ensure clients fully understand and agree to the services before proceeding. Question 6. A behavior analyst is using social media and posts a photo of their office space with a non-identifying caption. In the background, part of a client's visible treatment materials and a partially visible client name on a file folder are accidentally included. Is this action ethical? A. Yes, because the client's face is not visible. B. Yes, because the caption is non-identifying. C. No, because client confidentiality may have been compromised by visible identifying information. D. No, because behavior analysts should not use social media. Answer. C. No, because client confidentiality may have been compromised by visible identifying information. This question deals with maintaining client confidentiality, particularly in the age of social media. The key phrase, partially visible client name on a file folder, indicates that despite intentions, potentially identifying information was exposed. Behavior analysts must take all reasonable steps to avoid sharing any information that could identify a client or stakeholder, especially in public forums like social media. Even accidental disclosure through background details in photos or posts is an ethical concern because it violates the commitment to protecting client privacy. Be extremely careful and review all content before posting online to ensure no confidential information is visible or implied. Question 7. A behavior analyst is providing supervision to a behavior analytics supervisee. The supervisee asks for advice about a personal relationship issue they are having. According to the ethics code, how should the behavior analyst respond? A. Provide supportive advice on the personal issue to build rapport. B. Listen empathetically but gently redirect the conversation back to supervision topics and avoid giving personal advice. C. Tell the supervisee they must seek personal counseling. D. End the supervision session immediately. Answer B. Listen empathetically but gently redirect the conversation back to supervision topics and avoid giving personal advice. This question tests your understanding of the boundaries within a supervisory relationship. The phrase personal relationship issue highlights that the topic is outside the scope of professional supervision. Supervisory relationships are professional relationships focused on the supervisee's development of behavior analytic skills and ethical practice. Providing personal counseling or advice creates a dual relationship that can impair objectivity and exploit the power differential. It's appropriate to be empathetic, but ethically necessary to maintain professional boundaries and focus the supervision on relevant professional topics. Remember to keep supervision focused on professional development, not personal therapy. Question 8. A behavior analyst receives a subpoena requesting confidential client records. What is the first step the behavior analyst should take? A. Immediately send the records to the court as requested. B. Contact the client or their legal guardian to inform them of the subpoena and seek their consent to release the records. C. Ignore the subpoena as client confidentiality is absolute. D. Ask their supervisor if they should release the records. Answer B. Contact the client or their legal guardian to inform them of the subpoena and seek their consent to release the records. This question addresses the ethical response to legal demands for confidential client information. A subpoena is a legal order, but it doesn't automatically override client confidentiality without careful consideration. While behavior analysts must comply with legal requirements, their initial ethical duty is to protect client privacy. The first step is typically to notify the client or their representative about the subpoena and attempt to obtain their informed consent to release the information. If consent is not given, the behavior analyst may need to seek legal counsel to determine the appropriate response to the subpoena, which might involve asking the court to quash or limit the subpoena. Do not release confidential records simply because you receive a subpoena without first attempting to get client consent and/or seeking legal guidance. Question 9. A behavior analyst is designing a behavior change program for a client. According to ethical guidelines, the program should be based on what? A. Popular trends in education or therapy. B. Published literature, scientifically supported principles, and assessment data. C. The behavior analyst's personal experience and intuition alone. D. The preferences of the client's family, even if not supported by evidence. Answer B. Published literature, scientifically supported principles, and assessment data. This question is about the scientific basis of behavior analytic practice. The phrase designing a behavior change program highlights the requirement for interventions to be evidence-based. Ethical practice demands that behavior analysts base their recommendations and interventions on scientific knowledge, which means using procedures that have empirical support, are derived from behavior analytic principles, and are tailored to the individual client based on thorough assessment data. Relying solely on intuition, trends, or unsupported preferences is unethical because it may lead to ineffective or potentially harmful interventions. Always ground your practice in science and data. Question 10. A behavior analyst is considering using a restrictive intervention for a severe problem behavior that poses a risk of serious harm. According to the Ethics Code, before implementing such an intervention, what must be done? A. Get verbal approval from the client's parent. B. Ensure that less restrictive procedures have been attempted and found ineffective. C. Only use the restrictive intervention for a very short period. D. Inform the client's primary physician. Answer B. Ensure that less restrictive procedures have been attempted and found ineffective. This question focuses on the ethical use of restrictive procedures, especially for severe behaviors. The mention of a restrictive intervention for a severe problem behavior triggers ethical requirements for using such methods. Ethical guidelines require that restrictive procedures, which limit a person's movement or access or involve punishment, are only considered after less intrusive and restrictive methods have been assessed and proven ineffective in addressing the target behavior. This ensures the least restrictive effective treatment is always prioritized. Always exhaust less restrictive options before implementing more restrictive procedures. Question 11. A behavior analyst discovers that a colleague has been consistently billing for services not rendered. According to the Ethics Code, what is the behavior analyst's ethical obligation? A. Do nothing, as it is the colleague's responsibility. B. Report the colleague to the Behavior Analyst Certification Board, BACB, immediately. C. Address the issue directly with the colleague first, if appropriate and feasible, before reporting to the BACB. D. Report the colleague to their employer only. Answer. C. Address the issue directly with the colleague first, if appropriate and feasible, before reporting to the BACB. This question addresses the ethical responsibility to report violations and the steps involved. The discovery of a colleague billing for services not rendered describes a serious ethical violation, fraud. Ethical guidelines generally require behavior analysts to first attempt to resolve ethical concerns by bringing them to the attention of the colleague involved, assuming an informal resolution is appropriate and the potential harm is not substantial. If the issue is not resolved or involves significant harm, reporting to the BACB or other relevant authorities becomes necessary. Attempting to resolve informally first promotes collegiality while still upholding ethical standards. Remember, addressing concerns directly is often the first step, but reporting is required if the violation is serious or unresolved. Question 12. A behavior analyst is asked by a client's parent to advocate for the child's inclusion in a general education classroom, a topic outside the behavior analyst's expertise. What is the behavior analyst's ethical responsibility regarding advocacy? A. Advocate strongly for the parent's preference, as the parent is the client's guardian. B. Decline to advocate on this specific issue because it is outside their scope of competence. C. Agree to advocate but clearly state they are not experts in educational placement. D. Refer the parent to an educational consultant or advocate who specializes in that area. Answer. B. Decline to advocate on this specific issue because it is outside their scope of competence. This question tests the behavior analyst's understanding of their role in advocacy and the limits imposed by their scope of competence. The phrase outside the behavior analyst's expertise is the critical clue. While behavior analysts can advocate for their clients, their advocacy must remain within their areas of knowledge and skill. Advocating on educational placement issues without specific training or expertise would be unethical because it exceeds their scope of competence and could potentially harm the client's interests. Referring the parent to a qualified professional is the most appropriate action to ensure the parent receives competent guidance. Stick to advocating for things you genuinely have expertise in, like behavioral interventions or the right to effective treatment. Question 13. A behavior analyst is using telehealth to provide supervision to a supervisee in another state. The behavior analyst is certified by the BACB, but not licensed in the supervisee state, although the supervisee is licensed. Can the behavior analyst ethically provide supervision via telehealth? A. Yes, because the supervisee is licensed. B. Yes, because the behavior analyst is BACB certified. C. No, unless the behavior analyst meets the licensing requirements of the supervisee's state or is exempt. D. Yes, as long as the supervision is conducted remotely. Answer. C. No, unless the behavior analyst meets the licensing requirements of the supervisee's state or is exempt. This question addresses the ethical considerations of practicing across state lines, specifically via telehealth, and the importance of understanding jurisdictional requirements. Providing supervision constitutes practicing behavior analysis, and behavior analysts must comply with all applicable laws and regulations in the location where the client or supervisee is receiving services. This includes state licensing requirements. Simply being BACB certified or supervising a licensed individual does not override the need for the supervisor themselves to meet the legal requirements of the supervisee's state. Always verify and adhere to the licensing laws in the location where you are providing supervision or services, regardless of your location. Question 14. When discussing client information with a member of the treatment team who is authorized to receive the information, how should a behavior analyst communicate? A. Discuss the client using their full name and other identifying details. B. Use code names or initials whenever possible to protect privacy. C. Discuss only the information directly relevant to the client's treatment and the team member's role. D. Avoid discussing client information verbally, only use written reports. Answer. C. Discuss only the information directly relevant to the client's treatment and the team member's role. This question is about maintaining confidentiality even when sharing information with authorized individuals. The key is discussing client information with a member of the treatment team who is authorized. Even with authorized individuals, the ethical principle of minimum necessary disclosure applies. Behavior analysts should only share the specific information needed for that person to fulfill their role in the client's care, avoiding unnecessary details to further protect privacy. While using initials might offer some protection, the core ethical requirement is limiting the content of disclosure to what is necessary. Only share what is essential for effective collaboration on the client's case. Question 15. A behavior analyst is asked to use a procedure that is not yet supported by empirical evidence, but is requested by the client's guardian who heard about it online. What should the behavior analyst do? A. Implement the procedure because the guardian requested it, and they have the right to choose treatments. B. Decline to use the procedure and explain why behavior analytic interventions must be evidence-based. C. Agree to use the procedure but document that it is not evidence-based. D. Try the procedure briefly to see if it works for this client. Answer. B. Decline to use the procedure and explain why behavior analytic interventions must be evidence-based. This question is about the ethical requirement for behavior analysts to use evidence-based practices. The phrase "not yet supported by empirical evidence" is the crucial clue. Behavior analysts have an ethical obligation to use interventions that are scientifically validated to be effective and safe. Using unproven procedures simply because a guardian requests them or experimenting on a client is unethical and potentially harmful. It's important to educate stakeholders about why evidence-based practice is essential for ensuring effective treatment. Always prioritize interventions with demonstrated empirical support over fads or unsupported techniques. Question 16. A behavior analyst is supervising a new RBT, Registered Behavior Technician. During supervision, the behavior analyst observes the RBT implementing a procedure incorrectly, which could potentially harm the client. What is the supervisor's primary ethical responsibility? A. Document the error but allow the RBT to continue to avoid undermining their confidence. B. Immediately intervene to correct the procedure and provide corrective feedback to the RBT. C. Report the RBT to the BACB immediately for incompetence. D. Discuss the error at the next scheduled supervision meeting. Answer. B. Immediately intervene to correct the procedure and provide corrective feedback to the RBT. This question addresses the ethical responsibilities of supervisors, particularly when client safety is at risk. The phrase "implementing a procedure incorrectly" which could potentially harm the client, highlights the urgency and the potential for harm. A supervisor's primary ethical duty is to protect the client. If a supervisee's actions risk harm, the supervisor must intervene immediately to ensure the client's safety and provide timely corrective feedback and training to the supervisee to prevent future occurrences. Waiting or simply documenting the error would be unethical as it fails to protect the client. Client safety and effective training of supervisees are paramount in supervision. Question 17. A behavior analyst conducts a functional behavior assessment, FBA, and develops a behavior intervention plan. The plan is implemented, but data shows that the target behavior is not decreasing as expected. What is the ethical course of action? A. Continue implementing the plan for a longer period, assuming it will eventually work. B. Change the plan drastically without reviewing the assessment data. C. Reevaluate the plan based on ongoing data and potentially conduct further assessment. D. Discontinue services because the plan wasn't effective immediately. Answer: C. Reevaluate the plan based on ongoing data and potentially conduct further assessment. This question focuses on the ethical requirement for ongoing monitoring and evaluation of interventions. The key clue is data shows that the target behavior is not decreasing as expected. Behavior analysts must continuously monitor the effectiveness of their interventions using data and be prepared to modify or revise the plan if the data indicate it is not producing the desired outcomes. This commitment to data-based decision-making ensures that clients receive effective treatment. Don't stick with a plan that isn't working. Use your data to inform necessary changes or further assessment. Question 18. A behavior analyst is asked to provide services for a client who is a friend's child. Accepting this case would create what type of ethical concern? A. Confidentiality breach. B. Conflict of interest or multiple relationship. C. Scope of competence issue. D. Financial misconduct. Answer: B. Conflict of interest or multiple relationship. This question addresses the ethical guidelines regarding multiple relationships and conflicts of interest. The scenario describes accepting a friend's child as a client, meaning the behavior analyst would have both a personal relationship, friend, and a professional relationship, service provider, with the same family. This constitutes a multiple relationship, which can easily lead to conflicts of interest, impair professional judgment, and risk exploiting or harming the client or stakeholder. It is generally unethical to enter into a professional relationship with someone with whom you have a pre-existing personal relationship. Avoid treating friends or family members to maintain professional objectivity and boundaries. Question 19. A behavior analyst is presenting client data at a conference. How must the behavior analyst ensure client confidentiality is maintained? A. Only use the client's initials. B. Use of pseudonym and disguise or omit identifying details. C. Obtain written consent from the client or guardian to share the data publicly. D. Both B and C. Answer: D. Both B and C. This question addresses the ethical requirements for maintaining confidentiality when presenting client information publicly, such as at a conference. To protect privacy, behavior analysts must disguise or omit identifying details about the client, using a pseudonym or changing characteristics, and obtain informed consent from the client or their authorized representative before presenting their information or data in a public forum. Relying only on disguising details is not sufficient. Explicit consent is required for public presentation. You need both steps: disguise identifying info and get consent for public sharing. Question 20. A behavior analyst is developing a behavior plan for a client with limited communication skills. How should the behavior analyst ensure the client's preferences are considered in the plan development? A. Ask the client's parents what the client prefers. B. Use formal preference assessments and observe the client's engagement and reactions. C. Base choices solely on what is easiest to implement. D. Assume the client prefers typical reinforcers used with other clients. Answer: B. Use formal preference assessments and observe the client's engagement and reactions. This question highlights the ethical importance of incorporating client preferences into treatment, especially for individuals who cannot easily self-report. The key phrase, limited communication skills, emphasizes the need for objective methods to identify preferences. Ethical practice requires behavior analysts to involve clients in decision-making as much as possible. For individuals with limited communication, this involves using systematic methods like preference assessments and closely observing their behavior and reactions to different stimuli or activities to identify potential reinforcers or preferred conditions. Don't guess or rely only on others' reports. Use objective methods to find out what the client likes. Question 21. A behavior analyst is providing services funded by an insurance company. The company requires reporting on client progress. What information can the behavior analyst ethically share with the insurance company? A. The client's complete session notes, including personal details. B. Only the minimum necessary information required by the funding source to justify services. C. Information about the client's family and home environment. D. Details about other services the client is receiving. Answer: B. Only the minimum necessary information required by the funding source to justify services. This question tests your understanding of sharing confidential information with third-party payers like insurance companies. The principle of minimum necessary disclosure applies here. Behavior analysts should only share the least amount of protected client information required to fulfill the specific purpose, such as obtaining authorization for services or reporting progress to the funding source. Sharing excessive or irrelevant personal details is a violation of confidentiality. Always limit the information shared with third parties to exactly what is required for billing or authorization purposes. Question 22. A behavior analyst is supervising a supervisee who consistently arrives late for supervision sessions and fails to complete assigned tasks. What is the supervisor's ethical responsibility? A. Terminate supervision immediately due to unprofessional behavior. B. Document the issues and provide clear, timely feedback and consequences for the supervisee's performance. C. Ignore the behavior to maintain a positive relationship. D. Reduce the intensity of supervision to make it easier for the supervisee. Answer: B. Document the issues and provide clear, timely feedback and consequences for the supervisee's performance. This question addresses the supervisor's ethical duty to provide effective supervision and address performance issues. The description of the supervisee's behavior indicates a performance problem, consistently arrives late, fails to complete assigned tasks. Supervisors are ethically obligated to monitor their supervisee's performance, provide regular feedback, and address any issues that hinder the supervisee's development or potentially impact service quality or client outcomes. This includes setting clear expectations and implementing consequences for failure to meet supervision requirements. Effective supervision involves providing constructive feedback and managing supervisee performance issues professionally. Question 23. A behavior analyst is developing a fee schedule for their services. According to ethical guidelines, the fees should be: A. Based on what other providers in the area charge, regardless of qualifications. B. Commensurate with the services provided and clearly communicated to clients before services begin. C. Negotiated with each client based on their ability to pay. D. Higher for clients with more severe behaviors. Answer: B. Commensurate with the services provided and clearly communicated to clients before services begin. This question is about the ethical handling of fees and financial arrangements. Ethical practice requires behavior analysts to establish fees that are reasonable and reflect the services rendered, and most importantly, to discuss and agree upon these fees with clients or stakeholders before providing services. Transparency regarding costs is essential for informed consent and prevents misunderstandings. Avoid ambiguous fee structures or hidden costs. Ensure your fees are fair and that clients fully understand the financial agreement upfront. Question 24. When advertising their services, a behavior analyst must ensure their statements are A. Guaranteed to produce specific outcomes. B. Based on testimonials from satisfied clients. C. Accurate, objective, and not misleading or deceptive. D. Focused on highlighting dramatic success stories. Answer: C. Accurate, objective, and not misleading or deceptive. This question addresses the ethical standards for public statements and advertising. Ethical guidelines require that behavior analysts' public communications, including advertising, are truthful, objective, and not likely to create false expectations or mislead potential clients. Making guarantees using testimonials, which can be biased or unrepresentative, or focusing solely on dramatic successes is generally considered misleading and unethical advertising. Be factual and realistic in your public statements about services. Question 25. A behavior analyst is working with a client who turns 18 and is now considered a legal adult. The parents previously provided consent for services. What is the ethical requirement regarding consent now? A. Continue services with parental consent as before, as the client has a developmental disability. B. Obtain informed consent directly from the client, assuming they have the capacity to consent. C. Terminate services as the previous consent is invalid. D. Ask the parents if they believe their child has the capacity to consent. Answer: B. Obtain informed consent directly from the client, assuming they have the capacity to consent. This question addresses the ethical implications of a client reaching legal adulthood and a requirement for informed consent. Once a client reaches the age of legal majority, the right to provide informed consent transfers to them, assuming they have the capacity to understand the information and make decisions. The behavior analyst must now obtain consent directly from the adult client, even if parents were previously the legal guardians providing consent. If the client lacks the capacity to consent, the behavior analyst would then seek consent from their new legally authorized representative, example, appointed guardian. Always obtain informed consent from the individual legally authorized to provide it, which changes when a minor becomes an adult with capacity. Question 26. A behavior analyst is writing a report for an insurance company. To maintain confidentiality while including necessary clinical information, the behavior analyst should A. Use the client's initials and date of birth. B. Include full names of the client and family members, but state the report is confidential. C. Use a client code or pseudonym and avoid unnecessary identifying details. D. Omit all specific behavioral data to be safe. Answer: C. Use a client code or pseudonym and avoid unnecessary identifying details. This question is about practical steps to maintain confidentiality when creating professional documents that may be shared with third parties. While basic identifiers like initials might seem safe, using a client code or pseudonym, combined with omitting any details not essential for the report's purpose, provides a higher level of protection against accidental identification. Simply stating the report is confidential doesn't prevent identification if enough details are present. Omitting all data would make the report useless. Use client codes and limit details to protect identity in reports shared externally. Question 27. A behavior analyst is supervising a student intern who is having difficulty understanding a complex concept. The behavior analyst should A. Explain the concept using clear language, examples, and provide additional resources. B. Tell the student to figure it out on their own to promote independence. C. Assume the student is not capable of understanding and assign simpler tasks. D. Suggest the student drop out if they are struggling. Answer: A. Explain the concept using clear language, examples, and provide additional resources. This question is about the supervisor's ethical responsibility to provide effective training and support. Supervisors have an ethical obligation to train their supervisees competently, which includes explaining concepts clearly, providing examples, and offering additional support like resources when the supervisee is struggling. Abandoning the supervisee or assigning only simple tasks does not fulfill the supervisor's role in developing competence. Good supervision involves patient teaching and support for the supervisee's learning process. Be a supportive teacher who helps your supervisee grasp complex ideas. Question 28. A behavior analyst wants to use a new experimental procedure with a client. According to the Ethics Code, what is required before implementing this procedure? A. Justification based on personal success with similar procedures. B. Thorough review of available research, close supervision, and explicit informed consent from the client guardian acknowledging the experimental nature. C. Verbal assent from the client. D. Consultation with a colleague who uses the procedure. Answer. B. Thorough review of available research, close supervision, and explicit informed consent from the client guardian acknowledging the experimental nature. This question addresses the ethical considerations for using novel or experimental procedures when using procedures that are not yet established as best practice. New experimental procedure. Behavior analysts must proceed with caution and adhere to specific ethical safeguards. This includes reviewing any existing data, ensuring close supervision, and obtaining explicit informed consent that clearly informs the client guardian that the procedure is experimental, detailing known risks, and outlining alternatives. Using unproven methods without these safeguards is unethical. If you use something experimental, be sure you've researched it thoroughly, are supervised, and get explicit consent acknowledging its experimental status. Question 29. A behavior analyst discovers an RBT on their team has a personal relationship with a client's family member that could interfere with the RBT's objectivity. What should the behavior analyst, as the supervisor, do? A. Tell the RBT to keep the personal relationship secret. B. Assess the potential conflict of interest and take steps to mitigate risks, which may include changing the RBT's assignment. C. Ignore it if the RBT says it won't affect their work. D. Immediately report the RBT to the BACB. Answer. B. Assess the potential conflict of interest and take steps to mitigate risks, which may include changing the RBT's assignment. This question focuses on the supervisor's role in managing conflicts of interest involving their supervisees. The description of a personal relationship with a client's family member that could interfere with the RBT's objectivity points to a potential conflict of interest or multiple relationship for the RBT. The supervisor has an ethical responsibility to identify such situations, assess the risks to the client and the service delivery, and take appropriate action to eliminate or minimize those risks. This might involve discussing the issue with the RBT, implementing safeguards, or reassigning the RBT to a different client if the conflict cannot be managed ethically. Supervisors must actively manage potential conflicts involving their team members. Question 30. A behavior analyst receives a negative online review from a former client's parent that contains inaccurate and potentially harmful information about the services provided. What is the ethical way to respond publicly online? A. Respond to the review point by point, correcting the inaccuracies and defending the services provided. B. Ignore the review. Do not respond publicly. C. Post a general, non-identifying statement, acknowledging concerns about client satisfaction, but avoiding specific details or client identifiers. D. Contact the former client's parent privately to threaten legal action if the review is not removed. Answer. C. Post a general, non-identifying statement, acknowledging concerns about client satisfaction, but avoiding specific details or client identifiers. This question addresses the ethical challenges of responding to public feedback online while maintaining confidentiality. Responding directly to specific claims, even to correct inaccuracies, risks revealing confidential client information and violating privacy rules, as it implicitly confirms the individual as a former client. Ignoring it might be one option, but a general, carefully worded public statement acknowledging feedback without confirming identity or discussing the specific case allows the behavior analyst to demonstrate responsiveness without breaching confidentiality. Never respond to public reviews in a way that identifies the client or discusses their case. Question 31. A behavior analyst is providing services in a client's home. During a session, the behavior analyst notices signs of potential child abuse or neglect. According to ethical guidelines and legal requirements, what must the behavior analyst do? A. Document the observations in the client's record and monitor the situation. B. Discuss the concerns with the client's parents, first to understand their perspective. C. Report the suspected abuse or neglect to the appropriate state agency immediately. D. Terminate services to avoid becoming involved in a difficult situation. Answer: C. Report the suspected abuse or neglect to the appropriate state agency immediately. This question covers the critical ethical and legal obligation of mandatory reporting. Behavior analysts are typically mandated reporters, meaning they are legally required to report suspected child abuse, elder abuse, or harm to vulnerable individuals to the relevant authorities immediately. Discussing concerns with the suspected perpetrators, the parents in this case, or simply documenting without reporting is unethical and illegal, as it fails to protect the potential victim. Your primary duty is to protect vulnerable individuals by reporting suspected harm. Question 32. A behavior analyst is asked to provide a diagnosis for a client. Is it within a behavior analyst's scope of practice to provide a clinical diagnosis, example, autism spectrum disorder? A. Yes, if the behavior analyst has extensive experience with the population. B. Yes, as behavior analysts conduct assessments. C. No, providing a clinical diagnosis is outside the scope of practice for most behavior analysts. D. Yes, if they consult with a psychologist. Answer: C. No, providing a clinical diagnosis is outside the scope of practice for most behavior analysts. This question clarifies the typical boundaries of a behavior analyst's scope of practice regarding formal clinical diagnosis. While behavior analysts conduct assessments that inform treatment, providing a formal clinical diagnosis, like ASD, ADHD, etc., is generally outside the scope of practice for behavior analysts and is the role of licensed professionals, such as physicians, psychologists, or licensed clinical social workers with specific diagnostic training. Behavior analysts use behavioral assessment to identify functional relationships, not to provide medical or psychological diagnosis. Stick to your area of expertise. Behavioral assessment and intervention, not clinical diagnosis. Question 33. A behavior analyst receives funding from a grant to conduct research. The grant funding is running out before the research is completed. What is the ethical action regarding the research? A. Stop the research immediately as funds are depleted. B. Continue the research without pay until it is finished. C. Seek additional funding or make a plan to complete or terminate the research in an ethical manner, considering participant welfare. D. Analyze the incomplete data and publish preliminary findings as final results. Answer: C. Seek additional funding or make a plan to complete or terminate the research in an ethical manner, considering participant welfare. This question addresses ethical considerations in research, particularly regarding funding and completion. Running out of funding impacts the ability to continue research ethically. Behavior analysts conducting research have an ethical responsibility to complete their studies if possible or, if termination is necessary, to do so in a way that minimizes harm to participants and allows for the appropriate dissemination of results, even if preliminary. Seeking additional funds or planning a responsible completion or termination are ethical paths forward. Publishing incomplete data as final results is unethical research misconduct. Plan your research carefully, and if funding issues arise, prioritize participant welfare and responsible conclusion or continuation. Question 34. A behavior analyst is asked by a potential client's parent how effective behavior analysis is for treating autism. What type of statement is ethical for the behavior analyst to make? A. ABA is the only effective treatment for autism. B. Research shows that behavior analysis is an evidence-based treatment that has demonstrated effectiveness for many individuals with autism in improving various skills. C. Every child with autism I've worked with has made drastic improvements. D. It works wonders. You'll see amazing results. Answer. B. Research shows that behavior analysis is an evidence-based treatment that has demonstrated effectiveness for many individuals with autism in improving various skills. This question relates to making accurate and responsible public statements about behavior analysis. Ethical statements must be based on scientific evidence and avoid making exaggerated claims or guarantees. Stating that ABA is the only treatment, using anecdotal evidence, every child, or making overly optimistic guarantees, works wonders, amazing results, is misleading and unethical. A statement referencing research and demonstrating effectiveness for many individuals while highlighting skill improvement is accurate and aligns with the evidence base. Be factual and realistic when describing the potential outcomes of behavior analysis. Question 35. A behavior analyst is providing supervision to a supervisee who expresses feeling overwhelmed and stressed due to the demands of the supervision and their job. What is the supervisor's ethical responsibility? A. Tell the supervisee to manage their stress better. B. Listen empathetically and discuss strategies for time management or stress reduction and suggest seeking professional help if needed. C. Increase the supervision requirements to challenge the supervisee. D. Ignore the supervisee's feelings as supervision is only about clinical skills. Answer. B. Listen empathetically and discuss strategies for time management or stress reduction, and suggest seeking professional help if needed. This question addresses the supervisor's ethical role in supporting their supervisee's well-being, especially when it impacts their professional performance. Supervisees' stress and well-being can affect their ability to learn and perform effectively, potentially impacting client care. An ethical supervisor listens to these concerns, offers appropriate support within the boundaries of the professional relationship, like discussing time management, and suggests seeking professional help, like counseling, if the stress is significant, recognizing that they are not the supervisee's therapist. Support your supervisee's professional development by also acknowledging factors affecting their ability to learn and perform. Question 36. A behavior analyst is terminating services with a client due to lack of progress, despite repeated modifications to the intervention plan. What is the ethical process for termination? A. Stop providing services immediately and close the case. B. Discuss the reasons for termination with the client guardian, provide recommendations for future services, and assist in the transfer of care if requested. C. Simply inform the client guardian that services are ending via email. D. Terminate services and do not provide referrals to avoid liability. Answer. B. Discuss the reasons for termination with the client guardian, provide recommendations for future services, and assist in the transfer of care if requested. This question focuses on the ethical process of terminating services. Termination should be a planned and ethical process, especially when services are no longer beneficial. Behavior analysts must discuss the decision to terminate with the client guardian, explain the reasons, like lack of progress, provide appropriate recommendations for alternative services or next steps, and offer assistance in transferring services to another provider if needed to ensure continuity of care. Abrupt termination without support is unethical and can harm the client. Always plan for termination ethically, prioritizing the client's needs and future care. Question 37. A behavior analyst is using punishment procedures as part of a client's behavior plan. According to the Ethics Code, what specific ethical obligation accompanies the use of punishment? A. Ensure punishment is the first procedure implemented. B. Ensure a plan is in place for discontinuing the punishment procedure as soon as possible. C. Use punishment more frequently than reinforcement. D. Avoid conducting a functional assessment for behaviors targeted for punishment. Answer: B. Ensure a plan is in place for discontinuing the punishment procedure as soon as possible. This question highlights a specific ethical consideration when using punishment procedures. Because punishment can have negative side effects and ethical concerns, behavior analysts have an ethical responsibility to use it cautiously and have a plan in place to fade or discontinue its use as soon as the target behavior has decreased to an acceptable level, ideally transferring control to reinforcement procedures. Punishment should not be a permanent solution, but a temporary intervention used ethically and minimally. Always have a plan to fade out punishment and rely more on reinforcement as soon as possible. Question 38. A behavior analyst is asked to provide services to a client whose family belongs to a cultural group the behavior analyst knows very little about. What is the ethical course of action? A. Provide services using the standard procedures used with all clients. B. Decline services because the behavior analyst lacks cultural competence. C. Educate oneself about the client's culture through research, consultation, and supervision, and seek to incorporate culturally responsive practices. D. Ask the family to adapt to the behavior analyst's cultural norms during sessions. Answer: C. Educate oneself about the client's culture through research, consultation, and supervision, and seek to incorporate culturally responsive practices. This question addresses the ethical importance of cultural competence in service delivery. Recognizing limitations in cultural knowledge, knows very little about, requires the behavior analyst to take steps to become more culturally competent. This involves actively learning about the client's cultural background, consulting with knowledgeable individuals, seeking supervision, and adapting interventions to be culturally sensitive and effective, rather than applying a one-size-fits-all approach or declining services without attempting to bridge the knowledge gap. Strive to understand and respect clients' cultural backgrounds to provide effective and ethical services. Question 39. A behavior analyst is collecting data on a client's behavior. To ensure the data is accurate and reliable, the behavior analyst should: A. Collect data only when the client is performing well. B. Use valid and reliable measurement procedures and train implementers to collect data correctly. C. Adjust data points that don't seem to fit the expected pattern. D. Rely on parent report instead of direct observation data. Answer: B. Use valid and reliable measurement procedures and train implementers to collect data correctly. This question focuses on the ethical requirement for accurate data collection. Ethical behavior analysis is data-driven, and the integrity of the data is crucial for evaluating progress and making informed decisions. This requires using measurement procedures that accurately capture the behavior and ensuring that anyone collecting data, like RBTs or parents, is properly trained to do so consistently and reliably. Manipulating data or relying solely on potentially biased reports is unethical. Ensure your data is collected accurately and reliably through proper methods and training. Question 40. A behavior analyst is supervising a supervisee who is struggling with ethical decision-making in complex situations. What should the supervisor do? A. Tell the supervisee to review the ethics code on their own. B. Provide specific training and guidance on ethical reasoning and decision-making processes using scenarios and discussion. C. Avoid discussing ethics to prevent confusion. D. Make all ethical decisions for the supervisee. Answer: B. Provide specific training and guidance on ethical reasoning and decision-making processes using scenarios and discussion. This question addresses the supervisor's ethical role in training supervisees in ethical practice. Supervisors are ethically obligated to train their supervisees to be competent, not just clinically, but also ethically. This includes teaching them how to identify ethical dilemmas, apply the ethics code, and navigate complex situations through structured training, discussion of scenarios, and modeling ethical decision-making processes. Simply directing them to the code is insufficient. They need guidance on how to apply it. Actively teach and guide your supervisees on how to think through and resolve ethical challenges. Question 41. A behavior analyst publishes a research article. According to ethical guidelines, the behavior analyst must: A. Share their raw data with anyone who requests it without condition. B. Retain the data and research records for a reasonable period after publication and make them available to others seeking to verify the results. C. Destroy the data after the article is published to protect participant privacy. D. Only share data with colleagues who contributed to the research. Answer: B. Retain the data and research records for a reasonable period after publication and make them available to others seeking to verify the results. This question concerns ethical standards in research regarding data sharing and retention after publication. To promote transparency and allow for verification of findings, ethical guidelines typically require researchers to retain their data and research records for a specific period after publication and be prepared to share it with other qualified professionals who wish to reanalyze or verify the results, provided participant confidentiality is protected. Destroying data or only sharing with co-authors hinders scientific scrutiny. Be prepared to retain and share your research data ethically for verification purposes after publication. Question 42. A behavior analyst creates a social media page to share general information about behavior analysis. When sharing information, the behavior analyst should: A. Post photos of clients demonstrating successful outcomes with consent. B. Offer specific advice for individual behavior problems described by followers. C. Ensure content is accurate, evidence-based, and does not offer individualized client advice. D. Use testimonials from former clients to illustrate points. Answer: C. Ensure content is accurate, evidence-based, and does not offer individualized client advice. This question addresses ethical considerations for behavior analysts using social media for professional purposes. Social media is a form of public statement. Ethical guidelines require that information shared publicly is accurate, based on science, and does not compromise client confidentiality. Providing individualized advice online is unethical because it lacks the necessary assessment and consent process of a professional relationship. Using client photos or testimonials, even with consent, can raise privacy concerns and may be prohibited or strongly discouraged. When using social media, share general, accurate information and avoid providing advice about specific situations. Question 43. A behavior analyst is working in an agency where their supervisor asks them to implement a procedure they believe is unethical. What should the behavior analyst do first? A. Implement the procedure as instructed by the supervisor. B. Refuse to implement the procedure without discussion. C. Discuss the ethical concern with the supervisor and attempt to reach a resolution. D. Report the supervisor to the BACB immediately. Answer: C. Discuss the ethical concern with the supervisor and attempt to reach a resolution. This question addresses the ethical process for resolving conflicts when directed to engage in potentially unethical conduct. When a supervisor or employer directs a behavior analyst to do something they believe is unethical, the first step is typically to communicate their concerns directly with the supervisor-employer and attempt to resolve the issue by explaining the ethical implications and proposing alternative ethical actions. If this attempt fails or the violation is serious, then further steps like reporting to authorities or the BACB may be necessary, but direct discussion is usually the starting point. Always voice your ethical concerns professionally with your supervisor first. Question 44. A behavior analyst is developing a presentation for parents about strategies for managing challenging behaviors. The behavior analyst should A. Focus primarily on punishment techniques, as they are often effective. B. Present a balanced view including reinforcement, extinction, and other evidence-based strategies, emphasizing function-based approaches. C. Only discuss strategies that require specialized training to implement. D. Guarantee that parents will see a decrease in behavior problems if they use the strategies. Answer B. Present a balanced view including reinforcement, extinction, and other evidence-based strategies, emphasizing function-based approaches. This question addresses ethical considerations when providing information or training to non-professionals like parents. Ethical behavior analysts provide accurate, balanced information based on scientific principles. This means presenting a range of evidence-based strategies, not just punishment, and explaining the importance of understanding the function of behavior. Guaranteeing outcomes is unethical. Ensure any training or information you provide to the public or parents is balanced, accurate, and focuses on evidence-based, function-driven methods. Question 45. Before implementing any behavior change intervention, what ethical step is required? A. Obtain verbal permission from the client. B. Complete a thorough behavioral assessment to identify the function of the behavior. C. Guarantee the intervention will be successful. D. Consult with a medical doctor. Answer B. Complete a thorough behavioral assessment to identify the function of the behavior. This question highlights the foundational ethical requirement before designing interventions. Ethical behavior change interventions are developed based on a thorough assessment, particularly a functional assessment, to understand why a behavior is occurring, its function. Interventions based on function are more likely to be effective and ethical. Implementing procedures without understanding the behavior's function is considered unethical practice. Always conduct a thorough assessment, especially a functional assessment, before designing or implementing any behavior change plan. Question 46. A behavior analyst working in a clinic receives a referral for a client who lives in a remote area where behavior analysis services are not available. Providing services would require significant travel time for the behavior analyst. What ethical factors should the behavior analyst consider? A. The inconvenience and cost of travel for the behavior analyst. B. The client's need for services and the feasibility of providing effective services given the distance and resources. C. The potential for the behavior analyst to charge higher fees due to travel time. D. The fact that the client's need automatically overrides all other considerations. Answer B. The client's need for services and the feasibility of providing effective services given the distance and resources. This question addresses the ethical considerations when resources or location create challenges in providing services. While client need is important, behavior analysts must also consider the feasibility and effectiveness of service delivery. Accepting a case where distance significantly impacts the ability to provide consistent, quality services or supervision might be unethical if it compromises the client's outcome. Charging extra fees for travel is a separate financial arrangement issue. The ethical decision involves balancing the client's need with the practical ability to deliver competent services effectively. Consider if you can realistically provide quality, consistent services given the circumstances. Question 47. A behavior analyst is asked to use a procedure known to be ineffective or harmful by scientific literature, but it is requested by the client's guardian. What is the ethical obligation? A. Use the procedure since the guardian requested it. B. Use the procedure but document that it is not evidence-based. C. Decline to use the procedure and explain the scientific evidence and potential risks to the guardian. D. Consult with another behavior analyst and then decide. Answer C. Decline to use the procedure and explain the scientific evidence and potential risks to the guardian. This question reinforces the ethical commitment to evidence-based practice and client welfare. Using a procedure known to be ineffective or harmful is explicitly unethical, regardless of who requests it. Behavior analysts must advocate for effective ethical treatment and educate stakeholders about the risks of unproven or harmful methods, declining to implement them even when pressured. Your ethical duty to provide effective, non-harmful treatment based on scientific evidence outweighs requests for detrimental procedures. Question 48. A behavior analyst is supervising an RBT who expresses discomfort implementing a specific procedure in the client's plan. What should the supervisor do? A. Tell the RBT they must implement it as written. B. Dismiss the RBT's feelings as irrelevant to their job. C. Explore the RBT's concerns, provide additional training or support, modify the plan if necessary and appropriate, or change the RBT's role if the concern is unresolvable and impacts implementation fidelity. D. Have another RBT implement the procedure without addressing the first RBT's concerns. Answer C. Explore the RBT's concerns, provide additional training or support, modify the plan if necessary and appropriate, or change the RBT's role if the concern is unresolvable and impacts implementation fidelity. This question addresses the supervisor's responsibility to support their supervisees and ensure treatment fidelity. If an implementer like an RBT is uncomfortable with the procedure, it can affect how it's implemented and potentially impact outcomes. An ethical supervisor investigates the RBT's discomfort, is it lack of training, ethical concern, etc., provides necessary support or training, and makes adjustments to the plan or staffing as needed to ensure the procedure is implemented correctly and ethically. Addressing supervisee concerns supports both the supervisee and the client. Address supervisee concerns professionally to ensure effective and ethical service delivery. Question 49. A behavior analyst is creating a billing invoice for services. To ensure ethical billing practices, the invoice must A. Include block billing for all services provided in a day. B. Accurately reflect the services provided and the time spent, matching the clinical documentation. C. Round up the time spent to the nearest hour for convenience. D. Use generic service codes that apply to multiple activities. Answer B. Accurately reflect the services provided and the time spent, matching the clinical documentation. This question focuses on the ethical requirement for accurate and honest financial practices. Billing must be truthful and reflect only the services that were actually rendered and documented. This means accurately recording time spent and using appropriate service codes that match the specific activities performed, avoiding practices like block billing. Billing for a large time block without detailing specific services times, or rounding up excessively, which can be considered fraudulent. Your billing must be an accurate reflection of the services documented as provided. Question 50. A behavior analyst is conducting a risk-benefit analysis for a behavior intervention plan. What factors must be considered? A. Only the potential benefits for the client. B. The potential risks and benefits to the client and relevant stakeholders, including the likelihood and magnitude of effects. C. The ease of implementation for the staff. D. The cost of the intervention. Answer. B. The potential risks and benefits to the client and relevant stakeholders, including the likelihood and magnitude of effects. This question is about the ethical requirement to conduct a comprehensive risk-benefit analysis. Before implementing any intervention, Behavior analysts must weigh the potential risks against the potential benefits, considering both the client and others involved. Stakeholders. This analysis should be thorough, considering both the likelihood and severity of potential positive and negative outcomes. Focusing only on benefits, ease of implementation, or cost is insufficient and unethical. A true risk-benefit analysis considers all potential outcomes and their impact on everyone involved. Always weigh the potential downsides against the potential upsides for everyone involved before proceeding with the plan.